I'm now particularly excited to hear from you, Dr. Nicola Willand from RMIT. Thank you very much for joining us today. Nicola's from the College of Design and Social Context at RMIT, and her work has a strong focus on the intersection of housing, energy, health, and equity. And you're joining us today to share some insights about tackling hidden energy vulnerability. So thank you again. Welcome, and over to you, Nicola.
Thank you, and thank you for your interest. I'm a housing researcher and really interested in that intersection of housing, energy, health, and equity. So you'll hear from some of the projects that I've done over the years. Thank you. It's a long presentation, and I won't go into a lot of detail on all the slides, but the slides will be shared. But if you have to leave as well, here are the key messages. So energy vulnerability, so being at risk of energy poverty or of harm of energy poverty, is often hidden, but you can discover it in varied ways. These linkages between sectors and organizations are really critical in finding these people and connecting them to help. Also, these collaborations between organizations are quite varied. Few have shared decision processes. Delivery of energy assistance is also quite varied. So most effective are monitored referrals, hand-holding, and prescriptions. And health practitioners and local councils could really play a key role in connecting people who are suffering to help. Capacity building is needed at all levels, but organizational, systemic level, these are really key to ensure continued and sustained actions. Shared acknowledgement of the need to tackle energy vulnerability is difficult, especially at that top level. So frontline workers get it all the time, the politicians, not always. But we're all in transitions, like the healthcare is going through transitions, energy, housing is going through transitions. So these are opportunities for change. These are the two main projects that I'm going to talk about, and I'll introduce them as we go along. The rationale really was that in the UK, energy poverty is a health issue. So for almost 20 or 30 years, they've known this. So priority in all energy policies is given to health, and the health sector is also funding and really engaged. So what you see, for example, on the right is information that GPs give out about energy in the home and how to save it and to recognize concerns, and damp and mold as resources as well. So recently, a few years ago, a 4-year-old child died, and that triggered a lot. Nick has already talked about the assistant that is out there, so I won't go into that. Just saying that retrofit, so really improving the energy of housing, would be the best and most sustained activity. So there was a project funded by the Lord Mayor's Charitable Foundation. We're working with Housing Choices Australia and Homes Victoria to see how we could tackle hidden energy vulnerability through collaborations. And the aim was to inform capacity building strategies to mitigate this energy vulnerability through integrated and collaborative actions. So we define hidden energy vulnerability as the propensity of households to experience harm due to energy poverty, which may not easily be detected by the conventional means that we've got to find people, and also because householders are not putting up their hand and saying, I need help. So they are missing out on assistance. Okay, so we spoke to people from housing, health, energy support, and social service agencies, and a broad number of participants actually came from the health sector. And this is just a little bit to show how energy vulnerability can be hidden. If you are a welfare recipient, you get automatic energy assistance. But if you're too proud to put up your hand saying, I need help, if you get rent bill relief, for example, you pay your energy bills, it may be hidden. If you pull together as a group of families to help each other pay their bills so they all get their pay on time discount, it may be hidden. If you're disconnected from power, your fridge doesn't have power, but you connect it to your neighbor or to sort of a plug in the outer area, it's hidden. And a lot of people do not recognize that living in a cold and moldy home is actually a health risk. So there are various methods of identifying people. Conversations, frontline people are really key there. Observations during home visit, health assessment forms, rent arrears, indirect identification through other social support services, and spatial techniques. So frontline staff, they see people, they talk to people, and they know how to listen carefully. Housing staff, healthcare assessment officers who do the in-home assessment, and maternal and child health nurses, they go into all homes, they observe it on site. The NSAF is a questionnaire. There are questions there. If it's a yes, it's a red flag. Someone may be vulnerable to energy poverty. Housing staff, they understand if someone is not paying their rent, they probably also have difficulties paying their energy bills. And then other support services, for example, parents approaching someone saying, I got this money for sports activities for my child, but can I pay the energy bill? And then spatial techniques, don't find individual households, but at least find areas where there may be a need. Various models of interorganizational relationships, and some of them involved health. So I'll just look at those quickly. Coalitions, for example, so strategic alliances, we found in the 1 Million Homes Alliance, for example, civil society organizations and health organizations were already advocating together, and research partnerships often reach out to health organizations. Collaborations, really that sharing for problem solving and making decisions, didn't happen that often, but there were a few examples. For example, solar PV installation or community housing. It's far more complicated than most of us think if you're dealing with this vulnerable cohort of people. So a lot of hand-holding had to go into this explanation again and again, and health workers were key in getting these solar panels installed to save people money. Energy systems, so when it comes to the service delivery, we identified 7 that were partnerships, and 1 was unilateral services, and health was only really engaged in 2. Hand-holding, really important, so health workers were really keen in helping people all the way from what is this about, how will it work, and actually making decisions. And it's a simple thing like, you know, the energy company will call you, do you want your solar panels? And all you have to say is yes. People get insecure and they don't do that unless someone is there to support that. Unilateral assessments, that's where healthcare workers were really key. GPs, for example, they knew what to fill out into the forms for householders to get, for example, air conditioning, which social housing tenants can only get if there is a medical problem. GPs learned it from their patients and then advised other patients. So really interesting there. Letters of support, key tool, but also some energy distributors offered battery hires for their life support customers. So that was no partnership there. Challenges were like when these programs were designed, there was no recognition of householder needs, lack of retrofit programs. Again, that is far more sustainable than just giving people money. Insufficient and sporadic funding, public disappointment because householders learn about it from their neighbors. By the time they get to the organization who delivers it, it's gone. Time constraints, you're engaged with vulnerable householders. You need a lot of time to explain and to help them. Translation was a real problem, a huge lack of translated materials, and translators don't know about energy themselves. Retailer staff, you know, the call centers, people are not trained to deal with vulnerable householders. They change all the time. And limited evaluations of outcomes and lack of knowledge translation. So we couldn't really learn from what was happening. Also, householders are not jumping up and down. Yes, we want help. They are proud. They're reluctant. They're overwhelmed. Dealing with complex needs if people have got several vulnerabilities. Energy counselors got frustrated when they couldn't help people. So I think that's something that's often not recognized. And then the siloed approach of project design, restrictive funding agreements, you only have a year and that's it. And then the civil society organizations are competing against each other, which also is not helpful. And if organizations wanted to partner, to become involved, where do they find their partners? There was no central site for information, and geographical distance, obviously, in a country, even Victoria is a problem. Keys to success: engaging householders at the right time, showing empathy, so not being judgmental. Why are you doing this? Tailoring message to individuals and highlighting the link between energy and health was really effective. Then delivering of assistance is building that rapport with households, so intermediaries are trusted, they know how to do that. Facilitated referrals, so referring, but then following up. What did you find? Did it help you? And continuity of support through the individuals, the professionals, and simple messages and skilled translation and culturally appropriate translation of that knowledge. When it comes to collaboration, shared motivations, why are we doing this? Then complementing strength and burns in their professional skills was helpful. Selecting suitable partner organizations was often specific to the funder, but those who knew the local champions in the community helped. Maintaining relationships, really important. People change. Getting to know those people in power whose jobs don't change that often was also key, and clear communication and division of tasks, and being generous in information sharing. So when it comes to capacity building strategies, there are these 4 levels, and the institution buildings happens at organization and system level. But we really need to start with individuals. Householders don't know, but intermediaries don't know about energy either, because, and that's something that may need a little bit more research, a lot of the frontline staff are women. Whenever we ask them, they didn't know. They referred to men in their relationships. So, there's a real need across Australia around that. So training in energy literacy, identification, call center needs to be trained. So checklists may be a good tool for something like that. At the community level, also capacity building to build partnerships, healthcare organizations, again, key referrals from healthcare providers may help. So central website, hard copy information, all these tools can help build capacity. Local councils, as I said, may have a really useful role to play there. They could be that central point of referral, which is missing at the moment. They could assist with energy assistant implementations. And there's an example here from the UK where local council are engaged in that. Then at the broader system, for example, if we want structural reform, consider energy in all disciplines. If there's a public health and well-being plan, put energy into that. Cross-sectoral energy assistance and service delivery models. An example is the Gamblers Help, for example. People are referred from the GP to help, and then they could get help. Even people who are the care persons of those people who've got a gambling problem get help and can reach out. And new forms of assistance, so appliance manuals in different languages, home care service providers to offer more energy-related services, and regulatory reform, so minimum energy efficiency standards to help renters. But again, when it comes to advocacy, again, health policy people listen to health professionals, which is really interesting, far more than they listen to housing researchers. And we need more funding, more sustained funding. So there's this continuity of assistance, and really a lot more funding for retrofits, which helps the planet, health, people, and affordability. And just a way of where we said, can't we do it within the in-core care system? And we worked with 2 home care providers here. So let me introduce you to Jane. Lives in her family home, doesn't have money to heat the home at night, so she goes to bed at 6 o'clock. She gets help, she gets a barrier, she gets a ramp, but couldn't we give her insulation and a more efficient heater as well? So this is what this project looked at. So we did some organizational ethnography. We went into homes. What are your into the providers? How do you work, with the householders? What happens? And we interviewed stakeholders. And we came up with this model. Yes, we can integrate energy systems into the in-care system. When people are screened, there are questions, and just adding a few questions about energy would also help. We could have supplementary energy assessment tools, easy to down. The assessor said, you know, those questions are easy. We have to ask much more intrusive questions, and then referring to a support plan. But on the other hand, we also recognize that we need to integrate care into energy. We don't have an energy-related health vulnerability tool when we look at homes. We don't do a concession check when we do these energy audits like the scorecard. And then whenever we give energy advice, you know, check if people have got a concession and help them fill out all these forms, because that is quite bothersome. Oh, and one of the tools that we had for, go back one, so we provided these resources. So there was a vulnerability checklist for the in-care providers, because they saw people, they didn't have a word for what they were seeing. All they knew that it was a problem, and they didn't really know where to go. Financial counselors in the bigger organizations, they could help. But we had these thermometers, for example, from the Heatwave Help project. And they loved it and said, if we take this, we just leave it in the home, it's a conversation starter. And the Seniors Guide to Saving Energy, I think, is no longer in print. And there's another resource. This is really about capacity building across individuals, because people don't really know, they don't recognize health problems with cold homes, for example, in Australia, and they don't know what to do about it and what would be effective. So this is this little brochure that was developed in collaboration with the Bellways project in Europe. So their cities are trialing energy poverty interventions and measuring health outcomes. So it's the story of Vic, who lives with the grandmother in a home that is too cold in winter, too hot in summer, and then the energy bill comes and they can't go on holiday. So Poppy, the pet cockatoo, says, don't worry, I'll take you and we'll visit my friends in other countries and find out how they live in comfortable and healthy homes. So they visit various countries, meet the children, and Vic observes energy poverty, but also learns from the children there what they do to mitigate energy vulnerability. So Poppy gets into trouble and they always have to go to the next city. Eventually they come back, and everything that Vic has learned is then implemented in their home. And then on the last slide, everyone lives happy and healthily and comfortably in the home. So thank you very much for your interest. And if you're interested in this, you know, it's the PDF is free of charge, and you can add your own little resources if you want to print it and put it out in your council offices or doctor's rooms. You know, happy to help out. Thank you.
Thank you so much. Gosh, there's a lot in that. My goodness, and thank goodness we'll be distributing the slides. I'm sure we'll be able to pour over them as well. But so many ideas. I could pick your brains for a long time. But thank you so